Hi, Seth Bilazarian here on Haverhill Community Television, brought to you another episode of Matters of the Heart. I'm Seth Bilazarian, an interventional and clinical cardiologist with Pentucket Medical, and I'm joined again by my associate, Dr. Sunny Srivastava. These episodes we've been doing recently, another series we're in currently is being added to by Dr. Srivastava on topics that are health concerns that physicians are frequently asked about that we frankly don't have a lot of data about, but this information is in the public sphere, and we ourselves want to become educated about it. So Dr. Srivastava has taken on a subject that has come up as a question for health purposes, and that is, what's going on with these energy drinks? People have heard of one popular one is called Red Bull, or these other types of energy drinks. They're advertised on many TV shows, 5-hour energy. Are these drinks, these beverages, are they safe? Do they have some kind of health consequences? Should some people with some kinds of medical problems avoid them? What's in them? These are the questions I want to know, Dr.
Right.
Srivastava. So tell us, what's the story with these energy drinks?
Yeah, so it's an interesting thing. So it is energy drinks. First of all, it's a term that has been coined by the beverage industry, not even looked at or recognized by the FDA or the USDA at all. So that's the first thing. And what they are drinks that claim to provide the consumers of the drink with increased energy. Most of the ads don't necessarily focus on the fact that this is largely derived from the profound amounts of caffeine and sugar in the drink. They tend to imply or claim that the increased energy is really due to some mix of special herbs or vitamins, which
nutritional,
are
good nutritional things,
which are certainly thrown in there,
right.
But they definitely leave out often the caffeine content, the sugar content, and some other things that may potentiate the effects of caffeine. So this whole notion of energy drinks, it's not something new. It's been around for a long time, 50, 60, 70 years, but really most recently in the 1980s is sort of more of a contemporary history with it. In 1985 was the first big one that was produced called Jolt. It was introduced in the U.S., and their catchphrase or their slogan was all the sugar and twice the caffeine. That was their selling point, and I can remember it selling very well and seeing people drink it quite a bit, and it lasted for a while but then fell by the wayside. And then the next big one in the U.S. wasn't until 1995 where Pepsi introduced one called Josta, and I don't even remember this one at all. Do you remember that drink at all? It lasted for 4 or 5 years until '99, but I cannot remember this drink at all. Don't know much about it, but that went by the wayside. In Europe, they came a little bit later to this, but this is where it really caught on. And the first drink in Europe was something called Power Horse. That was the first one, and it was all very much heavy with caffeine and sugar. But the one that really broke the market and really came through was Red Bull. And that was developed by an Austrian entrepreneur. It was introduced to the U.S. in 1997, so it's been around for quite some time. And it has done very well. It has grown now where Red Bull represents 47 to 50% of the energy drink market. In 2011, there were 4.6 billion cans of Red Bull sold in over 160 countries across the world. They have almost 10,000 employees, so it's a gigantic corporation at this point, and it generated in 2011 $5.5 billion of revenue. So it's a large super company at this point. And the whole energy drink industry in general is a very large one. It became in 2007 a $5.5 billion industry, and it has grown to well over $12 billion, well over a $12 billion industry at this point. So it's a gigantic industry. And who's drinking these? For the most part, it's young men. 2/3 of the folks who are drinking are aged between 13 and 35, and men also make up about 2/3 of the consumers for the most part. So it leads us naturally to the next point of the discussion. What's in these things? What are the ingredients, generally speaking? So I keep talking about caffeine and sugar. And to speak more broadly, they contain a category of something called methylxanthines. Methylxanthine is a compound. Caffeine is one of the more common ones, but there are other ones. There's one called theophylline, which is actually a medication that's used for asthmatics, and that can be found in these, but caffeine by far is the most common methylxanthine found in these drinks. There's a lot of B-complex vitamins thrown in here. It's thought that these could promote energy. Various herbs, carbonated water usually is a mainstay. There's an herb called guarana, which actually is made up of a lot of caffeine. But when they list caffeine, they don't include the guarana content or how much caffeine is in there. There's something called yerba mate, which I'm not sure if I'm pronouncing it exactly right, but that is made up of caffeine and theophylline as well, so that's in there often. Taurine, then all sorts of herbs and supplements like ginseng or ginkgo or maltodextrin, carnitine, creatine, a whole lot of things can get thrown in there. Many of these contain very high levels of sugar. There are quote-unquote diet energy drinks which have the artificial sweeteners that you see in diet sodas in general. But it all boils down really to the caffeine. That is the most common ingredient. It often contains 3 times as much as a soda or a cola-based soda. So to run through some of the numbers real quickly, just sort of everything varies to some degree, but if you look at an 8-ounce cup of coffee, regular old coffee, 8-ounce cup of coffee, you have somewhere between around 100, let's just say 100 milligrams of caffeine. You look at tea, it's less, 50 to 75 milligrams of caffeine. 8 ounces of Coke, 50. Most people don't drink just 8 ounces of Coke. It's often 16, actually 20-ounce bottles now people drink a lot of. So you're getting a lot more. If you look at something like a Monster energy drink, that's a pretty common sold one. It actually has 120 milligrams per serving. But if you look at a can, it's actually 3 servings. So you're getting 360 to 400 milligrams of caffeine.
How big is this can you're referring to?
A Monster energy drink, I think it's a 16-ounce.
All right, so it's bigger than a usual can of soda.
Yeah,
Okay.
It comes in different sizes.
All right.
There's Monster Energy Assault.
Right, but it's kind of
Yeah.
deceptive to assume that there's 3 servings in that. Who's going to take a 16-ounce can and divide it into 3 servings?
Right, they're going to drink the whole can.
Right.
And so they're getting a gigantic amount of caffeine.
Right.
The sugar content in there is through the roof. And then on top of it, there's these other things such as guarana, which I mentioned, where I wrote it down here because I don't remember this. 1 gram of guarana equals 40 milligrams of caffeine. And a lot of these things, they don't list the amount of guarana that's in there. But nevertheless, you're getting more caffeine that way. Another thing that's pretty popular now are these energy shots. They come in much more concentrated, smaller sample sizes. So 5-hour energy is the one I think everyone sees on TV. A 5-hour energy is just 2 ounces or 50 milliliters. And it varies. It's hard to figure out what it has in it exactly. Caffeine's a big part of it. They claim that their 2-ounce thing of caffeine only has 150 milligrams of caffeine. You look at some consumer labs that have broken it down, and they find 220, 230, 215, a lot more than just what they claim. But there's all sorts of other ingredients in there that are not so well documented. And because there's no FDA oversight, USDA oversight, they don't really have to say much more about what's in there or how much is in there. So that's a downside, certainly. Let's see, what to talk about next. What are the effects? What happens to you when you drink these beverages? And we're going to get more into later on about the specific drinks, but there are a variety of physiological and psychological effects that you can see after drinking this. And there have been studies, although not big and not large, that have looked at and reported improved mental or cognitive performance, as well as subjective alertness in the short term after drinking these highly caffeinated beverages. That probably doesn't surprise too many, but there's a price to pay for that because we often see in these studies report that drinkers of this, in addition to this moderate euphoria that might be induced, they also have increased agitation, anxiety, irritability, obviously insomnia, these things. And it's thought that some of these negative effects can come from the withdrawal from caffeine, and that many people's performance is enhanced by reversal of that withdrawal. So reinfusing one with caffeine when you're withdrawing and coming off gets you back up to the performance. And it becomes a vicious cycle where you almost feel as if you need to keep infusing yourself with caffeine. There have been tests looking at studies looking at physical performance, looking at cycling and upper body cycling in young adults. And the energy drinks certainly increase upper body muscle endurance, no doubt about it. In fact, it's known that caffeine is a performance enhancer. It's banned by the International Olympic Committee to take before performance and such, so no doubt about it. It's known I can do that.
I didn't know that. So you can't have a latte before your Olympic sprint?
That's what I've read. I didn't know that either until I read this,
that seems
which
like
surprised me because...
That would be a challenge for the French and the Italians, I would think.
Yes, so that's what Right, or maybe there's a certain amount. Maybe there's a
maybe you can have one latte.
Yeah, maybe there's a certain amount of milligrams of caffeine when they check. I don't know. So there's certainly some data to show that there is increased alertness, physical performance, short-lived certainly, and conflicting data to say whether or not it truly is related to the caffeine versus the sugar versus some other synergistic effect of the two. We don't know. It's hard to say exactly. There's other stimulants that are added to these things, like ginseng, for example, is thrown in there. Other herbs that may potentiate the effects of caffeine or guarana. So we don't know exactly what's causing what in these.
So I think if I could just briefly summarize what you've said, not a lot is not known. The components of these drinks are some stuff that at very high doses we know is not good for you, like sugar and caffeine at very super high doses, but also a bunch of things that we really don't even know what is in them chemically because they're herb-based.
Yeah, and there's
is that safe? I mean, should patients from the audience just assume that
nope.
for something's from an herb, it's safe?
You should never assume that. That's a tremendous flaw in thinking to assume that just because it's an herbal remedy or an herb that it's healthy. There's plenty of poisonous herbs. There's plenty of herbs that are bad for you. For example, this guarana, which is a naturally occurring thing, is loaded with caffeine, and caffeine can come from naturally occurring things, and so you have to be careful. And the problem is we don't know much about this stuff. It hasn't been well studied. It's not regulated. I'm not sure you can. You know nothing about quality control, where these things are produced or made, or what you're really getting in these cans. There's numerous instances of when broken down by consumer labs, finding all sorts of other things in there that aren't listed on the ingredients, such as theophylline. I mentioned to you earlier off air that one of these drinks was found to have theophylline in it. Theophylline is a prescription medication used for asthmatics that can cause your heart to race, certainly, so as a side effect. So it's not something that one should assume is perfectly safe just because they're selling it to you in the store and it's full of herbs. I wouldn't make that assumption.
Okay.
So I guess a question I was going to ask or talk about was whether there was evidence to suggest that these things actually increase energy. It's limited. The studies aren't great. They're small. They're anecdotal. So I can't say definitively that it's the energy. But it doesn't surprise you that there's caffeine in it, so it's going to.
Right. Well, when you say increase energy, I mean it may have something that's not energy related. There's no doubt that caffeine increases alertness.
Absolutely. Yeah.
So that may be, even though it may not be a proper term, it does do something that people are spending money for, right? I mean, people are buying these things because it may not be more energy, just more alert. You have the fatigue or whatever is kind of.
Yeah, it absolutely does that, and it certainly can. And caffeine, no doubt, has been shown to improve physical performance, short-term type of stuff. So absolutely, it can do things. The question is, are we doing any harm with the amount of caffeine that's being ingested? We can talk more about that. So naturally brings me to the next question: what are the adverse effects? And it's generally thought that adverse effects from caffeine start to occur for an average, healthy-sized adult at amounts greater than 400 milligrams of caffeine. So it's a fair amount, but you can get to that pretty quickly if you're drinking one or two of these beverages in a day. Like I said, many people can start to develop nervousness, irritability, sleeplessness, polyuria, which is going to the bathroom frequently, dehydration, palpitations, heart racing, stomach upset. So a lot of things that aren't great. It can actually, if you're drinking it with certain antidepressants, can cause your pupils to dilate quite a bit, and so that's not desirable, certainly. And most mainstream energy drinks don't provide much in the way of electrolytes, for example. So if you're drinking a lot of that, caffeine is a diuretic, can become dehydrated and can develop some electrolyte abnormalities. Caffeine certainly, as I said, as a diuretic, can lead to you excreting water, become dehydrated, and it's said in many sort of athletic performance literature that 1% dehydration can lead up to a decreased performance of 10%. So physical performance. So hydration is certainly a key issue. There's lots of ER visits associated with energy drinks. People ending up there with racing hearts. There's actually been reports of people having seizures when withdrawing from the caffeine as well. So that's certainly been seen. So I mentioned this number of 400 milligrams as the number. That's for an adult. And
400 milligrams of caffeine you're referring to.
yes.
Okay.
They have made recommendations that pregnant women should be less than 300 milligrams. And children, they give a quote of 2.5 milligram per kilogram. So I was thinking of my son, who weighs about 50 pounds. And actually, if you do the math, it turns out to be essentially roughly 1 milligram per pound.
Okay.
Okay, so my son, 7 years old,
I'm
50
confused
pounds.
because it's 400 milligrams. People don't weigh 400 pounds. I'm confused.
No, for kids we're talking about. For
okay.
children, they
Okay.
do everything weight-based and
Okay.
such. So I think about my son, 7 years old, 50 pounds roughly, and so that should be 50 milligrams of caffeine he shouldn't exceed in a day.
Okay.
Shouldn't get any in my mind, but that's besides the point. But their recommendation, they can have up to 50. So a 100-pound kid, 100 milligrams, that's,
But focusing on the adult for a minute, the
Yeah.
400 milligrams, can we just do that again? So you told me that there was coffee, say it was around 50 milligrams?
Well, it varies. So there's a range depending on which coffee you have, how it's brewed, how it's served.
You said 30
So-
to 50.
No, it's more than that for coffee. Coffee was anywhere between 75 and 100.
Okay.
And it's the tea, which is a little less.
Okay.
And cola is even a little less.
Well, I was trying to just,
Yeah.
put this in units that I know. So 400 milligrams of caffeine per day is four to 5 cups of coffee,
cups of coffee.
would be the maximum.
Right. To me, that seems like a lot still. Even though this is what someone gives as a guideline, it still seems like a lot. And maybe we're a little bit skewed because we're looking at heart patients often and things like that, but it seems like a lot. Often, though, people are pouring cream in with each cup of coffee, sugar, et cetera, so it adds up in other ways as well. I mean, there's calories to coffee as well, so there are other issues there. But yeah, so that's what they list as 4 8-ounce cups of coffee a day is a reasonable thing. I tend to like less, but as a recommendation, but that's what some other people say. So, what else is negative? So those are sort of the main negative. And then it should be noted that again on these drinks, the caffeine dosage is not required to be on the product. They don't have to tell you what's in there. And these other things that are added in there, like the guarana we were talking about, they don't need to tell you about that. And so that's a problem. There's lots of advocates, of course, urging the FDA to change this or the USDA to get involved to view this as a food product. And right now it's not at all. So
What is it viewed as? Not a drug, it's
don't
not
know.
a food. What is it?
I don't know if it's a herbal thing. I'm not sure
Aren't
how it's viewed.
beverages food? Like, is it Coca-Cola?
So Coca-Cola is
a food?
Yep. Coca-Cola is monitored by the USDA, but these are not right now.
Wow, that's
So
interesting.
it's an interesting loophole, I guess,
Yeah.
if you will. So lots of more research has been coming out to sort of focus in on some of the negatives with this excessive caffeine, sugar consumption. Some real medical journals are starting to get involved. The University of Texas Medical School reported some stuff showing that energy drinks certainly contain much more caffeine. They did detailed laboratory analysis of some of these drinks and really proving that these energy drinks certainly do have much higher concentrations of caffeine than a typical strong cup of coffee, and that the caffeine, when combined with other ingredients that aren't really often reported on the label, can really have a synergistic effect, and actually maybe even more caffeine added to it as well. What else can I say about that? Well, let's talk about a little bit maybe what is the specific caffeine and sugar content in some of these drinks. You mentioned Red Bull earlier as one that's a commonly sold one, and the typical Red Bull comes in an 8-ounce can. And Red Bull isn't as bad as some of the other ones, but the Red Bull in one serving has, 80 milligrams of caffeine. So that's kind of similar to a cup of coffee. It's got 27 grams of sugar, though. That is a lot of sugar in 8 ounces. And a lot of kids are going out and drinking a lot more than just one 8-ounce can, certainly.
Remember, is it 5 to 6 grams of sugar in a teaspoon? Is that what that is?
Yes.
So 27 is like putting, what is the math on that? 6 teaspoons of sugar in your coffee. So Red Bull is like, we're saying, a cup of coffee with 6 teaspoons of sugar in it. Is that what we're saying?
Yep, absolutely.
Okay.
Some of the more interesting ones, though, so this Monster energy drink that I was talking about, the cans come in I guess they come in a 24-ounce can because there's 3 servings per container, and one serving is 8 ounces. But it's amazing. Each serving has 80 milligrams of caffeine, so you're getting 240 milligrams of caffeine in that one drink, and you're getting 27 times 3, so you're getting almost 90 grams of sugar in that one serving, which is a ridiculous amount of sugar. So what's the math there for the spoons? It's 5 5 into 90. Is that what we're talking about here? So
5 or 6 into 90. So
it's an amazing amount of, so that's 15...
18 teaspoons.
18 teaspoons of sugar in that 1 can of drink, plus all the caffeine. Plus the other stuff that, again, I keep referring to that we don't really know that much about that may, in fact, have a lot of caffeine in it. So you're getting a lot in there. The other one that we talked about is that 5-hour energy. I think we talked about that one as well, that, again, it's about 200 milligrams of caffeine in that one small little 2-ounce bottle. And there's numerous other ones. There's Rockstar, and there's various different names for these, all similar numbers and similar findings that I guess if you were to just drink one of them from a caffeine standpoint, maybe not so bad, but many people are drinking more than these. I know it's popular in mixed drinks, and that's an issue as well. When you mix these with alcohol, a couple things can happen. One is that the caffeine can increase your alertness, and you may not be as cognizant of how impaired you really are. And in fact...
So countervailing the sedating effects of the alcohol, you're saying?
Yes.
So you don't know how essentially drunk you are.
Right.
Okay.
And all these people, despite thinking that they are not as drunk as they are, or they're more alert, and all the functional testing that they undergo, they fail just as miserably as someone else who's just as drunk as they are, or has drank just as much. So it's a false sense of security, if you will. So people might be, I'm fine, I've drank, I've had Red Bull.
So I can drive home.
Yeah, I can drive home.
But I can't drive home.
They're just as bad. And in fact, there's the added problem of increased dehydration, certainly, when mixing the caffeine with the alcohol, 2 diuretics now. It's another issue on top of that as well. And so in the past, some of these big alcohol companies had marketed beverages with caffeine in it. So Anheuser-Busch had a product that had caffeine in their alcohol. They actually eventually agreed to withdraw those from the market. Coors, the same thing, had a product, and succumbing to the pressure from a lot of different angles, that they ultimately withdrew these from the market as not safe beverages to be selling to consumers. But you can go to any bar and order a Red Bull mixed with, with whatever you want, with vodka or what have you. And I think it's a pretty popular drink, certainly. But there's a downside to it, certainly. So let's talk a little bit more about some of these other ingredients that we keep referring to, and what are they, and where are they found, and what are their claims. So I have to read a little bit of this because I'm not familiar with a lot of these, but many of these drinks have carnitine in it, and they claim that it improves endurance, increases your metabolism, can even protect against cardiovascular disease. Some of these drinks have glucuronolactone. They claim that it promotes excretion of quote-unquote toxins, and that it will therefore protect you from cancer. Again, this is what they're claiming. Guarana increases energy, can enhance physical performance, may promote weight loss. Those are their claims. Inositol, they claim, can help some lipid profile things. There's ginseng, which may help with mental acuity. There's a few others there. Taurine, they claim, may help with blood pressure or diabetes. And yohimbine is actually thrown in there sometimes. Yohimbine is claimed to improve sexual performance or treat blood pressure, improve weight loss. And those are some of the claims. Now, is there data or scientific evidence to substantiate any of those claims? Most of them, no. So the carnitine, no evidence, no clinical evidence. Lactone, no evidence whatsoever. Guarana, there's certainly evidence that it can increase your energy because it's caffeine-based, basically. That's what it is. So yeah, there's evidence that it can do that. Inositol, no evidence. Ginseng, no scientific evidence. Yohimbine, absolutely there's evidence. It's in fact shown to improve, it's a treatment for sexual or erectile dysfunction. It increases blood flow to sexual organs. So it absolutely could be useful in the treatment of erectile dysfunction. I don't know if there's enough yohimbine in these drinks to get to that, but it by no means has any evidence to suggest that it helps weight loss. Next question naturally to ask is, are these other ingredients safe? No idea. There's not much data. So there's nothing on carnitine, nothing on the glucuronolactone. Guarana, if in small amounts, is thought to be safe, just like any other caffeine-based product. If it's a small amount, it's thought to be safe. Inositol is generally thought to be safe by the FDA. The other ones, the ginseng, no idea. And yohimbine, it is FDA approved for treatment of erectile dysfunction or blood pressure, but that's in a regulated fashion, so you're not sure what amount you're getting in these drinks. So not a lot's known about the safety of these drinks, or these ingredients, I should say. The question comes up, people try to drink these before they exercise sometimes, and without a doubt, caffeine is known to increase endurance. Like I said before, it's banned by the IOC. Caffeine prior to heavy exercise may be safe. Certainly it's thought to be safe. But caffeine in combination with all these other herbs and all these other ingredients, we have no idea. Interesting, there was a case several years ago in France where an 18-year-old died suddenly while playing basketball after drinking 4 Red Bulls. And so there was a push, and actually it was for a little while, taken off the market, banned in the country of France. But that got overturned. Norway, similar thing. It was banned for a while in Norway. It's back on the market. It's now in the market in every EU country, so that's not an issue. Some schools in England have tried to ban it from being sold in the town or nearby. Same thing here. But it's available everywhere. You can go to any convenience store and buy these things, certainly.
We're running a little bit short on time, and this has been an exhaustive review of a subject that I really am happy to know a little bit more about. But 2 basic questions. Young people are using this, and of course for you and I, with our adult patients, what's the recommendation currently? What would you think, knowing there's not a lot of information, you've reviewed that probably nobody knows what's in these products, what can we say safely for patients?
All the pediatric societies have categorically said they don't recommend it for adolescents or for children at all. Even though you may, I guess in theory you could think about maybe one small drink of this has a small amount of caffeine, but I just think there's too much unknown of what the other stuff's in there and how they interact and how much more caffeine may be lurking in there than what you think's in there. So they, by and large, just say, no, not recommended at all. And they don't say that about cola at all either. I mean, they don't like cola for other reasons, but they're not holding back the cola because of caffeine per se. So for that, no. For us too, with a lot of our patients with heart-related issues, caffeine at these levels can certainly raise blood pressure, increase heart rate. And so for a lot of our patients, for the reasons we see them, I wouldn't recommend them either. Again, because there's so much unknown. If you just look just at the caffeine, maybe you'd be okay with a small amount of one of them. But there's just so much other unknown stuff in there that I couldn't recommend them.
So if a patient says, look, I mean, I just can't get out of my own way, or I have a problem in the afternoon, would you say, well, you'd be better off using coffee? Would that be a recommendation?
We know a heck of a lot more about coffee than we do about any of these things.
Okay.
It could be wrong, too. Maybe they are okay. I don't know.
Right.
None of us know because we don't know these other ingredients.
Very good. Yeah. All right. Well, what a fantastic review of the topic of energy drinks brought to us by Dr. Sunny Srivastava, a subject that I think not much is known about, certainly from a medical standpoint. We didn't learn much about this when we were in medical school because these didn't exist, but from Dr. Srivastava's review, pretty much nobody knows much about these right now, but there's a bunch of components or ingredients in these beverages which nobody knows about the health effects of. But the health effects are of the medicine, of the ingredients like sugar and caffeine are at very high levels, and therefore they should be used very cautiously, if at all. I think that will be the take-home message.
Very fair.
And until next time, thanks for joining us on another edition of Matters of the Heart. I'm Seth Bilazarian from Pentucket Medical Associates. Thanks for joining us.